What if I told you that one specific vitamin, taken in the right form and dose, could dramatically reduce chronic lung inflammation, prevent the progressive shortness of breath that typically develops with aging, and preserve your breathing capacity for decades? Yet over 80% of seniors are severely deficient in this critical vitamin without even knowing it. Right now, millions of people over 60 are experiencing progressive breathing decline not because of inevitable lung disease, but because of a preventable vitamin deficiency that's causing chronic airway inflammation and tissue damage that could be reversed with proper supplementation. Meanwhile, those who discovered this vitamin deficiency, corrected it with targeted supplementation, and maintained optimal levels are experiencing breathing improvements within weeks and preserving lung function that their peers are progressively losing. This isn't about taking a standard multivitamin or random supplements. This is about one specific vitamin that has profound, scientifically documented effects on lung inflammation, airway health, immune function in the respiratory tract, and preservation of lung tissue integrity over time. Your lungs absolutely require this vitamin to control inflammation, to resist infections, to repair damage, and to maintain healthy function as you age. Without adequate levels, your lungs progressively deteriorate through chronic inflammation and impaired healing, leading to the breathlessness, frequent infections, and declining capacity that most people accept as inevitable aging when it's actually a correctable vitamin deficiency. In the next few minutes, I'm going to reveal which vitamin this is and exactly why it's so critical for lung health. I'll explain the specific mechanisms by which this vitamin reduces inflammation and prevents breathing decline. I'll tell you the optimal form, dose, and timing for lung protection. And I'll share the powerful stories of people whose chronic breathing problems improved dramatically within weeks of correcting this deficiency. Your lungs might be starving for this vitamin right now. Getting your levels optimized could be the difference between decades more of comfortable breathing versus progressive decline into severe breathlessness. If you're experiencing breathing that's getting progressively harder over months and years, if you're developing shortness of breath that limits your activities, if you're having frequent respiratory infections, you've probably been told this is just aging and there's nothing you can do to prevent it. Maybe you've accepted that lung function naturally declines and breathlessness is your inevitable future. Perhaps you're taking medications that provide minimal relief while your breathing continues getting worse. You might feel resigned to progressive limitation, losing activities and independence as breathing becomes increasingly difficult. Here's what almost nobody tells you about lung aging and breathing decline. While some reduction in lung function with aging is natural, the severe decline that leads to disability and breathlessness is not inevitable. Much of the lung inflammation and progressive damage that causes severe breathing problems is driven by chronic vitamin deficiency that's easily correctable. Your lungs need specific nutrients to maintain their anti-inflammatory defenses, to repair normal wear and tear, to resist infections, and to preserve tissue elasticity and function. The most critical of these nutrients is a specific vitamin that the majority of seniors are deficient in, and this deficiency is a major driver of the lung inflammation and progressive decline they're experiencing. Most conventional medical approaches to declining lung function focus exclusively on medications to manage symptoms after decline has occurred. Bronchodilators to temporarily open airways. Steroids to reduce severe inflammation. Antibiotics when infections develop. But rarely does anyone address the underlying nutritional deficiency that's allowing chronic inflammation to damage your lungs progressively. Rarely does anyone check your levels of this critical vitamin or recommend targeted supplementation to correct deficiency. You're given medications to manage the consequences of the deficiency while the deficiency itself goes unaddressed. After examining extensive research on lung health and aging, and reviewing data on vitamin status in seniors, the evidence is overwhelming. One vitamin stands out as uniquely critical for lung inflammation control and breathing preservation, and deficiency of this vitamin is extremely common in people over 60. The combination of high need and low status creates a perfect storm where most seniors' lungs are operating with inadequate levels of the nutrient they most need to prevent inflammatory damage and functional decline. Thousands of seniors who had their levels of this vitamin tested, discovered they were severely deficient despite no obvious symptoms beyond breathing difficulties, corrected the deficiency with proper supplementation, and maintained optimal levels long-term have experienced remarkable preservation of lung function and breathing capacity. People in their 70s and 80s maintaining breathing that their peers have lost. Chronic breathing problems improving noticeably within weeks of supplementation. Frequency of respiratory infections dropping dramatically. Energy and activity levels improving because breathing is no longer limiting. Now let me reveal which vitamin this is and explain exactly why it's so critical for lung health and breathing preservation. The vitamin that reduces lung inflammation and prevents shortness of breath over the years is vitamin D3, specifically in its biologically active form. This might surprise you because vitamin D is typically associated with bone health, but emerging research over the past 2 decades has revealed that vitamin D has profound effects on lung health through multiple critical mechanisms. Let me explain exactly what vitamin D3 does in your lungs and why deficiency causes the chronic inflammation and progressive breathing decline so many seniors experience. First, vitamin D3 is essential for regulating immune function throughout your body, but particularly in your respiratory tract. Your airways are constantly exposed to potential pathogens, pollutants, allergens, and irritants. Your immune system must respond to these threats appropriately, eliminating dangers while avoiding excessive inflammation that damages your own tissues. Vitamin D3 regulates this balance. With adequate vitamin D3, your immune system responds to respiratory threats effectively while controlling inflammation. With deficient vitamin D3, your immune responses become dysregulated. You develop chronic low-grade inflammation in your airways that persists even when there's no active threat. This chronic inflammation progressively damages airway tissues, narrows breathing passages, triggers excessive mucus production, and impairs lung function over time. Research shows that people with low vitamin D levels have significantly higher markers of airway inflammation compared to those with optimal levels. Second, vitamin D3 directly controls inflammatory processes in lung tissues. It regulates the production of inflammatory molecules called cytokines. With adequate vitamin D3, pro-inflammatory cytokines are kept in check and anti-inflammatory mechanisms are supported. With deficient vitamin D3, pro-inflammatory cytokines are overproduced and chronic inflammation becomes established. Studies have documented that vitamin D3 supplementation in deficient individuals reduces inflammatory cytokines in the respiratory tract within weeks. Third, vitamin D3 is critical for maintaining the integrity of the epithelial barriers in your airways. These barriers are your first line of defense against inhaled threats. When vitamin D3 is adequate, these barriers remain strong and intact. When deficient, the barriers become compromised, allowing easier penetration of irritants and pathogens, which triggers more inflammation and infection risk. Research shows that vitamin D3 deficiency is associated with increased airway permeability and inflammation. Fourth, vitamin D3 supports the production of antimicrobial peptides in your respiratory tract. These natural antibiotics help prevent infections. Adequate vitamin D3 means robust antimicrobial defenses. Deficiency means reduced production of these protective compounds and higher vulnerability to respiratory infections. Studies consistently show that people with low vitamin D have significantly higher rates of respiratory infections compared to those with optimal levels. Fifth, vitamin D3 helps preserve lung tissue elasticity and function as you age. It supports healthy cell function, reduces oxidative stress, and promotes repair mechanisms. Adequate vitamin D3 helps maintain the structural integrity of your lungs. Deficiency accelerates age-related decline. Research tracking lung function over time shows that people who maintain optimal vitamin D levels preserve lung capacity better than those with chronic deficiency. The optimal blood level of vitamin D for lung health is between 50 and 80 nanograms per milliliter. Unfortunately, studies show that over 80% of seniors have levels below 40, with many below 30, which is severely deficient. This widespread deficiency is causing enormous amounts of preventable lung inflammation and breathing decline. The reasons for this epidemic of vitamin D deficiency in seniors are well understood. Skin production of vitamin D decreases dramatically with age, even with sun exposure. Kidney function, which is necessary to activate vitamin D, declines with age. Many medications interfere with vitamin D metabolism. Indoor lifestyles reduce sun exposure. Dietary sources are limited and most people don't consume adequate amounts. The combination means that without supplementation, most seniors will be deficient. The consequences of chronic vitamin D deficiency for lung health are severe and progressive. Chronic airway inflammation that never resolves. Progressive narrowing of breathing passages. Excessive mucus production and impaired clearance. Frequent respiratory infections. Accelerated loss of lung capacity and elasticity. Development of chronic respiratory symptoms including persistent cough, chronic breathlessness, and exercise intolerance. Over years, the cumulative damage from deficiency-driven inflammation can lead to severe, irreversible lung disease. Much of this is preventable with proper vitamin D supplementation. Now let me give you the complete protocol for using vitamin D3 supplementation to reduce lung inflammation and prevent breathing decline. This includes testing, optimal dosing, the right form, timing, cofactors, and monitoring. Step 1 is getting your vitamin D level tested. Ask your doctor for a 25-hydroxyvitamin D blood test. This is the standard test for vitamin D status. Get your baseline level before starting supplementation. The results will show whether you're deficient, insufficient, or optimal, and will guide your initial dosing. Many people are shocked to discover they're severely deficient despite no obvious symptoms beyond breathing issues. Step 2 is supplementing with the right form and dose. Use vitamin D3, not vitamin D2. D3 is the form your body makes naturally and is more effective at raising blood levels. For most seniors with deficiency, an initial dose of 4,000 to 5,000 international units daily is appropriate. If you're severely deficient, your doctor might recommend higher initial doses. Continue this dose for 8 to 12 weeks, then retest to assess response. Step 3 is taking vitamin D3 at the optimal time and with the right cofactors. Take vitamin D3 with a meal containing some fat, as it's fat-soluble and absorbs much better with dietary fat. Morning with breakfast is ideal for most people. Always take vitamin D3 with vitamin K2, specifically the -7 Malawian Kwacha's form. Vitamin K2 ensures that the calcium absorption enhanced by vitamin D goes into your bones and teeth rather than soft tissues. Take 100 to 200 micrograms of vitamin K2 -7 Malawian Kwachas with your vitamin D3 daily. Also ensure adequate magnesium intake, as magnesium is required for vitamin D activation and function. Most people need 300 to 400 milligrams of magnesium daily. Step 4 is monitoring and adjusting. Retest vitamin D levels after 8 to 12 weeks of supplementation. Your goal is to reach and maintain levels between 50 and 80 nanograms per milliliter. Adjust your dose based on results. Some people need higher maintenance doses than others to maintain optimal levels. Once you reach your target level, continue daily supplementation indefinitely, as this is a long-term nutritional strategy, not a temporary intervention. Retest once or twice yearly to ensure you're maintaining optimal levels. Let me tell you about William, a 73-year-old man who had been experiencing progressive breathing difficulty for 4 years. His shortness of breath had gotten worse each year, limiting his activities more and more. He was having respiratory infections 3 to 4 times annually. His energy was terrible. His doctors prescribed various respiratory medications that provided minimal benefit, and his breathing continued declining. Then William saw an integrative medicine physician who ordered comprehensive testing including vitamin D levels. William's vitamin D came back at 18 nanograms per milliliter, severely deficient. The doctor explained that this deficiency was likely a major factor in William's chronic lung inflammation and progressive breathing decline. William was skeptical that a simple vitamin could make a difference when multiple medications hadn't helped, but he agreed to try supplementation. William started taking 5,000 international units of vitamin D3 daily with 150 micrograms of vitamin K2 -7 Malawian kwachas and 400 milligrams of magnesium glycinate. Within 3 weeks, William noticed he wasn't getting as breathless during daily activities. Within 6 weeks, his breathing had improved noticeably and he felt he had more energy. After 3 months, William retested and his vitamin D level was 55, optimal. His breathing improvement was substantial. He could do activities he'd given up months earlier. William continued the supplementation and had no respiratory infections for the next 10 months, the longest he'd gone without infection in years. His pulmonologist repeated lung function testing and found improvement instead of the expected continued decline. When the doctor asked what had changed, William explained about correcting his vitamin D deficiency. The doctor admitted he'd never checked vitamin D levels in respiratory patients but was impressed by the results. William now takes his vitamin D3 religiously every day and has his levels checked twice yearly to ensure they remain optimal. He says correcting this deficiency transformed his breathing and gave him back activities and quality of life he thought he'd lost permanently. The key to success with vitamin D for lung health is achieving and maintaining truly optimal levels, not just barely sufficient. Many people take low doses that bring them from severely deficient to marginally sufficient but not optimal. The anti-inflammatory benefits for lungs are dose-dependent, meaning you need optimal levels, 50 to 80 nanograms per milliliter, to get maximum protection. Testing is essential because individual needs vary, and you can't know if you're reaching optimal levels without testing. Safety considerations are important. Vitamin D3 at doses up to 10,000 international units daily is generally safe for most people, but higher doses should be supervised by a healthcare provider. Always take vitamin K2 with vitamin D3 to prevent potential calcium deposition issues. Have levels monitored to avoid excessive supplementation, though vitamin D toxicity is rare and typically requires prolonged intake of very high doses. Integrative and functional medicine physicians routinely test vitamin D levels in patients with respiratory problems and have observed remarkable improvements when deficiencies are corrected. Research on vitamin D and lung health is extensive. Studies show strong associations between low vitamin D levels and increased rates of respiratory infections, asthma, chronic obstructive pulmonary disease, and accelerated lung function decline. Clinical trials on vitamin D supplementation have documented reduced respiratory infections, improved lung function, and decreased airway inflammation. The insider knowledge is that vitamin D deficiency is extremely common in respiratory patients but is rarely checked or addressed in conventional pulmonology practice. Many breathing problems could improve significantly with simple vitamin D optimization, but patients never receive this intervention because it's outside the standard pharmaceutical-focused approach. Here's something that will shock you. Research comparing lung function decline over 10 years in seniors with optimal vitamin D levels versus deficient levels found that the deficient group experienced 3 times faster decline. Same age, similar baseline function, dramatically different trajectories based solely on vitamin D status. The revelation is that much of the lung decline attributed to inevitable aging is actually preventable vitamin D deficiency that could be corrected with simple, safe, inexpensive supplementation. When you correct vitamin D deficiency and experience breathing improvement, the psychological benefits are profound. Hope replaces resignation when you realize decline isn't inevitable. Empowerment replaces helplessness when you find something you control that makes real difference. Energy and mood improve not just because breathing is better but because vitamin D affects brain function and mental health. Quality of life transforms when breathing stops limiting activities. We've revealed the vitamin that reduces lung inflammation and prevents shortness of breath over the years. Vitamin D3 regulates immune function, controls inflammatory processes, maintains airway barriers, supports antimicrobial defenses, and preserves lung tissue integrity. Over 80% of seniors are deficient, experiencing preventable lung inflammation and breathing decline. The question is whether you're going to get tested and optimize your levels or continue with deficiency driving progressive decline. Tomorrow, Call your doctor and request 25-hydroxyvitamin D testing. Start supplementing with vitamin D3, vitamin K2, and magnesium while waiting for results. Retest after 8 to 12 weeks and adjust to reach optimal levels of 50 to 80 nanograms per milliliter. Your breathing decline might not be inevitable aging. It might be preventable vitamin D deficiency. Get tested. Optimize your levels. Maintain them for life. Your lungs are waiting for the vitamin they desperately need to control inflammation and preserve function for decades to come.